once again, GeoFox, and we're back discussing more unfortunate information. The terrifying reality of Trump's Megabill creates for transgender people. Now, this article is being brought to me by MSNBC, and I will have additional links and information in the description box below. But in this video, we're going to be discussing the so-called Great Big Bill, right? That the House, the U.S. House, has passed, okay, at the federal level through our Congress folks. And it is now being sent to the U.S. Senate. And if the Senate votes, this could potentially go into being passed into a legislation and sent to President Trump's desk to be signed into legislation. So let's talk about it. Imagine going to the doctor and being told that the medication you've been taking for years is now illegal to prescribe to you. The doctor can give it to other people who are different from you, people experiencing depression, for example, or women going through menopause or cancer patients, but it's no longer allowed for people like you. And that's exactly what's happening to transgender people. I talked about it. I've been talking about it for a while. Like literally this year, as of February, I no longer have an actual doctor to go to because my doctor is no longer accepting health insurance because of the implications at the federal level around treating intersex and transgender people. Give no other options, you go home. After a few days, you start feeling the initial effects of living without the medication. Your brain gets foggy, you start dissociating. A few months in, your body starts to change. Okay, so if you are a woman, that means thick, coarse hairs start sprouting on your arms, chest, and face. Everything gets affected. The way you smell, the way your body distributes fat, the way the hair on your head grows or doesn't grow. The people in your life stop recognizing you, and everyone else in society no longer sees you as who you really are. The only way out of this new reality is likely getting your medications on the black market or dying because your body can't produce a hormone you need. That is the gutting choice facing more than 270,000 transgender people who are on Medicare if Trump's big beautiful budget passes the Senate and gets signed into law. So late Wednesday night last week, y'all, so today is May 30th, okay? So on the 21st, May 21st, last Wednesday, news broke of a manager's amendment to the budget that changed what was initially a ban on gender-affirming care for youth on Medicaid into a ban on adult transition care on Medicaid. A change to one line in the budget bill removed a distinction between youth and adults, thus expanding the ban to hundreds of thousands more people. Plus, the ban not only covers gender-affirming surgery, but also includes a ban on coverage of hormone replacement therapy or gender-affirming hormones, gender-affirming healthcare. Why is it okay for cis men to get testosterone, but intersex and trans men can't get testosterone? Why is it okay for cis women going through menopause to be able to get estrogen, but trans women and intersex women can't get estrogen? You're literally targeting a demographic of people and discriminating against them based off of who they are. How is that not blatant discrimination? Not to mention, people can literally die because they don't have hormones. You need hormones to function in order to live. Again, that's just like telling a cis man who is going through testicular cancer, prostate cancer, that he can't get hormones, he can't get testosterone because he had to have his testicles removed in order to free his body from the testicular cancer. You're going to kill hundreds of thousands of people because of your hatred against transgender people? Not to mention, we are all paying taxes for Medicaid, Medicare, and Social Security to exist. Every time you get paid through your job, look at your pay stubs, look at your paycheck. A portion of your pay stub, your paycheck, is being deducted each pay period to pay for Social Security, Medicare, Medicaid, and then you're going to turn around and tell the folks that are paying for these things that they can't have access to what they're paying for. That is what's happening right here in the U.S. under Trump's second term, under Trump's administration. Coupled with the Medicaid ban is further provision no longer requiring that Affordable Care Act health insurance plans cover gender-affirming care for adults as an essential health benefit, which would allow individual health insurance companies that sell market plans to potentially drop their trans-related coverage. For those who have already had bottom surgery and depend on hormone replacement therapy to produce the sex hormones they need to survive, the situation would literally be life or death, because no one can live without a dominant sex hormone. The Republican budget would make it illegal for a post-op trans person to access the hormone that affirms their gender, but they would be able to prescribe the hormone associated with their birth sex. So, for example, estrogen would be denied for trans women, but testosterone would be allowed, and vice versa for trans men. Testosterone would be denied to trans men, intersex men, but yet estrogen would be pushed on you, even though if you were born intersex, you were never male or female to begin with. So it's just something to think about, and then you're telling folks that they have to basically die or go the illegal route to get their medications off of the black market, where there's no way to know if that is quality hormones or if that's a quality medication. How are you going to track your levels? All of these things come into play. But again, when people are ignorant and transphobic and hatred is the way that people are moving, you don't care about life. As much as this party claims to be pro-life, they're anti everything that would be pro-life for various demographics of people. Not to mention, they're aiming to gut Medicaid and Medicare across the board. So cisgendered people would also be getting kicked off of their Medicaid, Medicare health insurance plans. Not to mention, in rural areas, entire hospitals and clinics would be closing. The message, therefore, is clear. Either detransition or potentially die. That's the decision this Republican government would be forcing upon post-op trans people who rely on Medicaid, unless they can manage to pay for treatment themselves or access illegal and unregulated sources for the hormones their bodies rely on to function. Trans people who haven't yet completed genital reconstruction surgery face a similar choice, though being forced off life-saving hormone replacement therapy is potentially deadly in another way. When denied gender-affirming care, trans people are at an elevated risk of suicidal. Okay? A more chilling thought is whether this might suit Republicans' purpose just fine, given years of measures taken to push trans people out of society. So, I'm just, more information will be in the description box below. But this is what a lot of us in the intersex and transgender community are facing and have been living with. And this is why I felt the way I felt last year, and the year before, 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 and the year before. People literally think politics is a joke, is a game, and you're playing with real people's lives. A lot of folks sit up and they didn't care because they weren't the ones being targeted, which is literally the epitome of being selfish and privileged. Cis people could care less, but now that they're about to lose their Medicaid and Medicare, all of a sudden, oh my God, where was this November 5th, 2024? Where was this? Where was this? Again, that selfishness is harming every single body. Thinking that you're the only group that matters is harming every single person in society. Not just in the US, but across the world globally. At some point, you have to start caring about the well-being of others. And at this point, I'm going to keep saying it. People with privileges need to be speaking up and stepping up and being on the front line, because you're not the one that's being thrown to the wolves. All of these cis men who claim to be your friends and supporters need to be speaking up for you. All of these cis women who claim to be your friends and supporters and family members need to be speaking up for the trans community, for the intersex community. All of these heterosexuals who claim to be allies need to be speaking up for the LGBTQIA+ community. All of the people such as myself who we don't rely on Medicaid and Medicare, we might have health insurance that we're paying out of pocket for, or that we have the privilege of having through our employer, we need to be speaking up for the people that are on Medicaid and Medicare. We need to be speaking up for the people that rely on Social Security. We need to be speaking up for the people who need food stamps, EBT, who need SNAP benefits. It's a privilege to not have to rely on that. And at the same point, we're all paying taxes so people can have these things. Why shouldn't you want others in your community to have access to affordable, accessible, inclusive, and quality healthcare, insurance, coverage, and providers? Why shouldn't you want other people in your community to be able to have groceries and to be able to eat and nourish their bodies? Why shouldn't you want other people in your community to have shelter? Y'all better I've been saying this for a while. You better wake up, because when you think it's not going to impact you, sooner or later, and nowadays it seems to be sooner than later, it will impact you. Okay? I've been saying this for a while. That selfishness, that narcissism, that privileged mindset where it ain't that serious until it is serious is not gonna help y'all. You better wake up. I'm telling you, wake up. Trans people deserve the same opportunities to get health care coverage just as much as cisgender people. Intersex people and trans people deserve the same privileges as cisgender people. LGBTQIA+ people deserve the same privileges as heterosexual people. There shouldn't even be poor people, if we're being honest. Everybody should have a quality, decent life where they don't have to live check to check. They don't have to live in poverty. They don't have to be homeless. We have to do more. We have to speak up, and we have to stand together against fascism, hatred, and bigotry.